Welcome to our channel. Today's topic emphasizes the importance of selecting the appropriate anesthesia for elderly patients undergoing short wrist or hand surgeries, such as Colles fracture reduction or other hand surgeries. These patients often have multiple comorbidities like ischemic heart disease or chronic kidney disease, making anesthesia selection crucial. This scenario is commonly presented in UK exams. I will illustrate the key points to help you understand this important subject. The choice of anesthesia in elderly patients with comorbidities like CKD and IHD requires a comprehensive assessment of the patient's overall health, careful selection of anesthetic agents, and vigilant perioperative monitoring to ensure safety and optimal outcomes. Age-related changes in physiology can affect how anesthetic drugs are metabolized and eliminated, leading to a higher risk of postoperative cognitive dysfunction and delirium. CKD patients often require adjustments in drug dosing and careful monitoring due to altered pharmacokinetics and the risk of drug accumulation. 34. Anesthetic agents that are less dependent on renal clearance are preferred. Patients with IHD are at an increased risk of perioperative cardiovascular events, such as myocardial infarction and arrhythmias. Anesthetic management should aim to minimize myocardial oxygen demand and avoid tachycardia or hypertension. For an elderly female patient aged 78 years who sustained a Colles fracture and has chronic kidney disease and ischemic heart disease as comorbidities, the anesthesia plan must be carefully tailored to address the complexities of her condition. This type of fracture typically requires close reduction and immobilization and may necessitate surgical intervention. Anesthesia options include local anesthesia, example a hematoma block, regional anesthesia, or general anesthesia. In elderly patients undergoing wrist surgery, regional anesthesia is often favored due to its lower systemic effects, which translates to fewer side effects and faster recovery. It also provides superior postoperative pain management and can lead to higher patient satisfaction. However, in the presence of CKD and IHD, the choice of local anesthetics and vasoconstrictors must be judicious to avoid exacerbating renal impairment or causing cardiovascular complications. Monitored anesthesia care, MAC, offers a comfortable experience with light sedation, often supplemented by local anesthesia for pain control. However, the elderly may be more sensitive to sedatives, increasing the risk of delirium or cognitive issues post-surgery. General anesthesia ensures total unconsciousness and is suitable for more complex surgeries, with the benefit of regulated breathing and monitoring. Yet, it carries a higher risk of postoperative complications such as confusion, cardiovascular events, and even long-term cognitive decline. In summary, while regional anesthesia is generally preferred for its minimal impact, each option must be carefully considered against the patient's health profile and surgical needs. Anesthetic agents less dependent on renal clearance include propofol, a widely used intravenous anesthetic with rapid onset and short duration, primarily metabolized by the liver, etomidate, another intravenous anesthetic with minimal renal excretion, metabolized by hepatic and plasma esterases, fentanyl, an opioid analgesic primarily metabolized in the liver, dexmedetomidine, a sedative with hepatic metabolism and minimal renal excretion, and sevoflurane, an inhalational anesthetic with minimal renal metabolism, primarily eliminated via exhalation. These agents are preferred for patients with compromised renal function, as they reduce the risk of accumulation and toxicity. In conclusion, regional anesthesia, particularly through a brachial plexus block or local infiltration, emerges as the optimal strategy for an elderly patient with a Colles fracture and comorbidities such as CKD and IHD. This approach not only provides targeted analgesia and anesthesia, but also significantly reduces the likelihood of systemic complications. Please consider liking, subscribing, and hitting the bell icon to stay updated on future videos.